I just want to sort of give you the principles that guided us as we put this plan together, and it may answer some of the questions that some of you might still have. One, do we guarantee that every American can get affordable coverage? Yes. Two, do we demand that we get more value for our health care dollar rather than imposing a new tax or passing a new obligation to the future generations? I think when you have an opportunity to see that, you'll see that we do it. Do we transform the health care system so that we focus on keeping people healthy and well instead of only treating them when they get sick? Hopefully we've answered that question. Do we make health care coverage affordable for those with pre-existing conditions? We have the most novel approach on the back end to accomplish that anybody's come up with. 5, do we end the current discrimination in the tax code that benefits the wealthy and corporations but fails the poor and those who can't get coverage through their employer? I think we've answered that. And 6, do we guarantee that health care is accessible when people want it, where people want it, and by whom? I would tell you those are the 6 elements that every plan that's introduced will be held to. And I would tell you that Tom mentioned the 7th, which is it sustainable? Can we sustain this for the future? And I think the answer for ours is yes. Yeah.
One of the tenets of those in both parties is that if you're happy with what you have, you can keep it. Now, the argument that the Republicans are making about the public plan is that everybody will end up in the public plan and that you won't be able to keep what you have. I think the argument that Democrats will make about your plan, and they've been making about the Wyden plan, or at least the original incarnation of it, is that if you get rid of the employer exclusion entirely, then employers will stop offering coverage. And again, you won't be able to keep what you have, that everybody will be dumped into the individual market.
That's just not the case. Look, employers under our plan will still be able to deduct the provision of health insurance to their employees off of their taxes. So employers still have the tax benefit to offer health insurance to their employees. That's point number 1. Point number 2 is they're not losing the tax benefit. The tax benefit is simply being transferred to themselves, instead of being attached to their jobs. One of the things they can do under this bill is they can dump their entire tax credit into their health savings account and pay premiums out of that health savings account, pay their out-of-pocket costs that they incur with their employer-sponsored plan out of their health savings account. And when you do the math, the vast majority of Americans will be better off, will have higher wages and more money in their pocket to go toward health care or whatever they want it to go to. So we're simply saying, instead of discriminating against people who don't get health care from their job, and look, a lot of firms are dropping health insurance. They're cutting back on it. And so fewer and fewer Americans are actually benefiting from this tax policy, which was a 20th century relic. We want everybody to be treated the same. And we believe by giving this tax benefit to the person, they get to take it with them from job to job. It's not locked with their job. If they lose their job, they get to have the same tax treatment. They can take their health insurance with them. And then employees of firms get to choose. Do I want to keep what I have? Great, they can. And they have more tax money to deal with it. Or if they want something else, they can do that as well. So the individual has the tax benefit and the freedom to make their own choice.
Let me also point out one specific thing in the analogy that you used, comparing 2 plans. We've said throughout this that without addressing successfully a healthcare system that actually invests in prevention, wellness, and disease management, it's unsustainable healthcare. So we may have some similarities or some differences as to how we pay for what we're doing, but structurally, we reform healthcare. We transform it from one that triggers when you get sick to one that incentivizes healthy decisions. I'm not sure that anybody's on that pathway to successfully accomplish that. That's going to be the distinction between plans.
Senator Coburn, Matt Tobias with Modern Healthcare, but you touched a little bit earlier on the Medicaid piece, and I'll open the question up there on, but if you can go a little more into that, talk about the relationship and how it would change between states and their citizens who are on Medicaid.
Well, let's say I'm on Medicaid, all right, and my family. Right now, in Oklahoma, I get a card, and I can go to about 55% of the doctors, primary care doctors, and about 25 or 30% of the specialists, and they'll see me. Now, I'm not a priority in their office because my payment rate is about 35% lower than what I could even get from Medicare or private insurance. So first of all, I'm limited in terms of the numbers that I have. and I'm not a priority when I come because my payment mechanism is way down the list. What we do is we say there should be no difference that any provider sees between the person with the best health care plan and somebody that needs our help. So all of a sudden, we elevate a Medicaid patient to the same status that everybody else has. In other words, they don't know that you're a Medicaid patient because you got a health insurance card. So first of all, we take away the differential. The money, I guarantee you in Oklahoma, I can't remember, I think it was $190 million a year saved by the state of Oklahoma under this plan on their Medicaid. $1.9 billion over the next 10 years. I believe that's a number. I may have to correct that, have my staff correct that. Well, what would that do to Oklahoma in terms of helping with education if we had this plan in where we had them all covered on insurance? Remember, of this large group of people that aren't covered today, there is a segment, about 20 to 24%, that are people with chronic disease. But the vast majority of them are young and healthy people who don't have insurance. So when you add that large number and truly get an indemnified program that includes Medicaid and everybody else, all of a sudden the total cost for everybody goes down because you're putting the health into the mix. And we don't see any discrimination in terms of them being able to access the care they want and the doctor they want for their children or themselves as they enter the healthcare market.